Live from UBC Studios in Kampala. This is Good Morning Uganda Extra.
Well, a very good morning. My name is Jagan Asemakola Ziksoka. Welcome to UBC TV. Good morning, Uganda Extra. Today, it's another very lovely day, the 14th of April in this year, 2022. And it is Good Morning Uganda Extra. Thank you so much. Our last segment of Good Morning Uganda today. Now, we'll just get into the conversation and we will, once again, talk about COVID, vaccination and what that means. Now, yesterday, there was a story carried in one of the dailies that said Uganda runs short of COVID patients. Now, whatever that meant and whatever the editors there wanted to mean, but that's where we are. And of course, we'll talk about COVID and that other conversation. Joining me in studios today are two experts here from the Kampala Capital City Authority, Directorate of Public Health and Environment. And of course, immediately here is Mr. Habomjisha Martin from the same department and an officer for monitoring and evaluation. Welcome, Mr. Habomjisha.
Thank you.
Happy to have you in studio this morning. Together with Habomjisha is Dr. Alex Indiabakira from the same directorate. Welcome, Dr. Alex.
Thank you, sir.
I'm happy to have you.
Good morning, viewers.
Good morning. When we talk about COVID today, are we in order to the viewers and the public and everybody now, or because to many people, COVID is now a thing of the past and it is in our history? Are we relevant when we discuss and talk about COVID today? Dr. Alex.
Oh, yes. Good morning, viewers, once again, and thank you for hosting us. We are relevant. We are here to reaffirm that COVID still exists. We have it with us here, but we thank everybody. It's because of everyone's efforts that we are living life the way it is. Our efforts, me and you and the community, that it is what we are seeing. But yes, we still have COVID.
For monitoring and evaluation, Mr. Habomjisha, talk to us, because when COVID just came in here, we got numbers and we're very meticulous on statistics to know. We are now in an open economy now, fully opened. We are back to churches, we are back to mosques, we are back to entertainment, we are back to sports, we are back into public transport. We are virtually back into everything. The other day, when we were burying the late speaker Jacob Lokorio Lanya, at a jury where we were, they estimated we had about 20,000 people who came. And all of us were in one field, we were in the same tents, we were virtually together. And that's what it is like. When we talk about COVID now, what are the statistics that could explain to us what the situation is like for us to even know whether it is still with us or not?
Thank you, sir, and good morning, viewers. This has been possible because of the interventions such as vaccination. And this morning in Statistics Unit of Monitoring and Evaluation, these are the figures currently we are talking about. Just to make us understand where we've come from and where we are going, cumulatively the country has had about 164,000 positive cases from the time COVID came into our country. And as of late, cases keep diminishing or reducing because of the interventions, just like we've said. We've had a number of deaths, just like we are aware from the surge cases that have been happening previously. And we still have some patients under home-based care, under hospitalization, just to mention a few. And we have administered about 19 million doses to people. And this is a good milestone. And just I talk on behalf of the city, where at least the target population of the city.
19 million doses is for the whole country?
Yes, administered.
For the whole country?
Yes.
19 million are full doses or 1 and 2?
1 and 2. Okay. All combined. But for the sake of the city, we have had at least, because the city has about 1.6 million people that we are living within the city, at least each of us, 1.6, have had at least one dose, 100%. 1.6 million people have had at least one dose, and about 65% are fully vaccinated.
65% of the 1.6 million?
Yes, have had at least 2 doses, and those who have had maybe Johnson & Johnson, including them. Because as we are aware,
That's more than 700,000 people.
Yes, please.
Oh, that's a good number.
Yeah, thank you.
That's more than 700,000 people.
Thank you.
Okay, and so those are the people that we've vaccinated. What are you campaigning for? What are you driving now as Kampala Capital City Authority, especially from the Department or Directorate of Public Health and Environment at this particular time? You notice that not so many of us actually still put on masks. And it seems like it's even arrogant, say it's pride of sorts, it's now class to put on a mask or so. People have shunned masks, people have shunned washing hands. We don't find washing facilities now. In some places, there are just a few pockets of offices where you go and you find sanitizers. Some people only put on masks when they're attending public events. Some test for COVID now when they're going to attend public events. And you know, so what is the situation like, and what are we even drumming up to?
Thank you. Just to add to what my colleague has said, we need to know that the uniqueness of the city, of the situation in the city. Whereas you have about 1.6 million residents, that's what we call night population for purposes of planning. You are aware that because of the dormitory effect, you have about close to 5 million people during the day. And these are people who reside in Wakiso, who reside in
the metropolitan,
Kono, in the metropolitan area, but flock the city to earn a living during the day.
I am one of those. Just come to the city to earn a living and run out of the city.
Okay, so you come with the COVID during the day and take it back home in the evening. Anyway, so the target for Kampala for most health interventions is a moving target. As far as we are concerned, when we evaluate the performance of the Kampala Capital City Authority in terms of delivering vaccines to the residents, we say, wow, we are doing well. Because you're given at least 1 dose to each person. You've vaccinated almost fully, almost 70%. But that's according to the targets you were set. But deep inside, you are aware that you have almost 5 million people that spend daytime with you. So we still feel we need additional efforts. We need additional support. We call on everybody to make sure we now surpass the target. Yes, we vaccinated over 100% of our target, but we are aware that the people who reside in Mukono are our people because they spend daytime with us, and you can only vaccinate during that day. So essentially, they are supposed to be vaccinated by the Kampala Capital City Authority, where they spend most of the time. So we are still, the traction is still on to vaccinate as many people as possible, because we are aware that much as we have hit the target of the initial targets that were given based on the residents of the city, we still have quite a huge number of unvaccinated people.
Okay.
From the neighborhood.
And what's the vaccination program like now? What's your vaccination plan? Because I no longer hear you ask people to come for vaccination. I don't even hear people say, I'm actually going to the city to go and vaccinate. We now come to the city. We are very preoccupied with the skyrocketing prices of commodities, not to get vaccines.
I think what we are working on currently, first of all, I need to correct you that actually, as we talk now, the Kampala Capital City Authority is implementing its 3rd round of accelerated vaccination campaigns.
Okay.
So as the ministry, it has guidance to do routine COVID-19 vaccinations using what we call stat clinics. These are public health facilities, private not-for-profit facilities that do normal, let me call them normal vaccinations on normal days. But increase access, ministry thought that it was important to have what we called accelerated vaccination campaigns. These are campaigns where we set up numerous outreach sites across the entire country, for this case, the capital city. So whereas the rest of the country is implementing their 2nd, because of the uniqueness of the city, we are finalizing the 3rd. So because of the skyrocketing prices and other things that are happening that you're talking about, maybe that's how you missed it. But at the moment, it's ongoing in the entire city.
Where, for example?
These campaigns are happening across the 5 divisions of Kampala, Machinde Division, Nakawa Division.
At the headquarters?
Kampala Center, no. Different divisions have designated different outreach posts across all their parishes. So we've had this campaign to bring the vaccines close to the public. Yeah.
Okay, and the vaccines themselves, because we had multiple vaccines, but there's one that was called, I think, Johnson & Johnson, which needed only a single dose, and the others were double doses. So what vaccines do you actually have now, and is anybody at liberty to ask for a particular dose, a particular vaccine that they want, or it's at your discretion to see what to vaccinate me with?
So the strategy was, a vaccine equity for hard to reach areas, for instance. And I talk about this because you talked about J&J, which was supposed to be a single dose. Because J&J, once you get a single dose, you're considered fully vaccinated until you are due for booster. So that was largely earmarked for areas that are hard to reach, so that if we are able to get you in Buvuma Islands, you are fully vaccinated. And it was largely never distributed in areas, especially the city here, which were thought to be highly accessible. But the good news is that now, as I talk, we have enough J&J for anyone residing in the city. We also have others, but the J&J, which is an incentive for people who do not have time and they want to get just a single shot, I think they should rush to the nearest vaccination post now. And get a job.
So at a particular vaccination point, in Makindye, in Nakawa, in Kawempe, in Central Region here, or in Rubaga, are there all these types of vaccines, and which are they anyway?
At the moment, I think we have 2 types that we are giving, and one of them is Pfizer, which, you are aware at that time when US started, government started procuring some Pfizer, everyone wanted Pfizer. Pfizer is being one of those big pharma. So we call upon everybody to rush. It's a very efficacious vaccine. And then as well as J&J. We also have others, the other types, because what you need to know is that, initially there was talk of if you received AstraZeneca, then what do you receive for your second dose? And information and science was very scanty in terms of recommending, if you have received AstraZeneca, what should be your second dose if AstraZeneca is not available. But now there is a wide available evidence in terms of vaccine mixing. And I cannot go into the details here, but the moment you come to the vaccination site, we will have something for you based on what you received as your first shot. Okay.
So what is available currently? You said there are 2 vaccines. You have J&J and Pfizer. But there was a time when majority of us were receiving, or majority of Ugandans were getting AZ, AstraZeneca, and it's what was almost everywhere. What about for those people? Or let me ask it this way, from you now, the doctor, the expert. From the time one received the first dose, they relaxed, they got swayed away with lots of things, and maybe they're just watching TV this morning and just discovered, I remember taking 1 dose, and they think it's incumbent upon me to go and get the second dose, and they now think about it now. What happens? It's long overdue that they got their first dose, and they want to do it now. Are there people who got the first dose, and
they have expired? No.
It has expired, and they need to start the process all over again?
No. We as long as you receive the initial dose, whichever dose you're going to receive is going to be the second dose to complete your schedule. Once you complete your schedule and you're fully vaccinated, then you can only be due for the booster. We were coming to that. Who is eligible for booster and when do you receive it? But this is usually after at least 6 months from your second dose. That's when we can give you a booster. So everybody who has received dose 1, if it's not J&J, of course, where you get 1 dose and you're fully vaccinated, is as long as they have reached either 4 weeks or 1 month, 4 weeks ideally, or 8 weeks, based on which dose you received, vaccine you received. you're due for your second dose and you don't expire.
Why I'm actually emphasizing on this, and I thank God that you came. At my church in Indeba, we conducted a mass vaccination for the community. And we worked in collaboration with, I think, KCCA, but courtesy through Ruvaga. And we vaccinated up to about 9,000 people in the community. Majority of these were actually receiving for the first time. We did that in December 2021. We have not done it again. We have not done it again, and I've not had church say they are coming back in April or May or June or July. So I don't know. Now, and I'm only thinking, what about the people who got the vaccine, who got their first dose in December when we did it? It was at the end of December. And they think maybe they were supposed to come back to church to get the second dose. Church has not made any arrangements to give them the second dose. What do? There are those who could say or are saying, we trusted church and we are waiting for church. What about if we get to June, July, August and church has not said, please come back again? What happens?
I think once we have community outreaches, for example, that organized outreach by the church, the vaccinators or the health workers usually talk to these people as they come to get vaccinated. That next time we may come back to church or not come to church as we have organized this time. So it's prudent for us as the public, when you go for these vaccines, they always tell us, if we don't come back here, please go to the designated health centers, the public and public not-for-profits that we have always have as a static. This time, they are actually doing it routinely on everyday basis. So these people were actually told, if we don't come back here, please visit your nearest health centers, the likes of Kawala, Chitebi, which are close to that church. And again, outreaches keep changing because we want to bring these services close to the population. So if today we are in Ndeba, the next day we may go to Bulange, the other day we go to Nambole, to make sure all the areas are covered and the services are close to the people. That's the main objective. So don't get worried that the church has not organized again. We are sure the public was told what to do if we don't come back. And these people could have gone to the designated health centers as they were told during the time when they are getting vaccinated.
Is it for every Ugandan, or there are categories of people who are supposed to vaccinate and some are not supposed to get vaccinated?
We started with what we called priority groups, and that was happening because of the resources.
Exactly. We didn't have enough vaccines.
Initially, the vaccines were not enough.
So we started with frontliners and the essential workers.
Exactly. But as we talk now, we have enough vaccines, just like the ministry is saying vaccines are available, so everyone 18 years and above can go and pick shot the vaccines, and then 12 years and above for Pfizer specifically. Thank you.
12 years and above
for Pfizer.
For Pfizer
specifically.
Then the others 18 and above.
18 and above, yeah, you can receive any vaccine.
Whatever you want to get.
Yes, but for children, you know, 12 to 18 is the category of children. We only have evidence that you can only administer Pfizer. The rest have not yet. You know, when you look at vaccine development, you must make sure that the vaccines they do what they are supposed to do, but they should also be very safe. So it's only safety for the Pfizer that has been studied in that particular age group, if you want to vaccinate, but they have to have comorbidities.
Okay.
If they have comorbidities.
Okay, so how about those who are 12 and below?
12 and below, not yet. We do not have enough sufficient evidence to vaccinate them. So whereas the vaccines may not be safe for that particular age group, no one has that evidence to show that they have done trials in 8-year-old, in 10-year-old, and so you can give them this particular
Now, how about
vaccine.
the virus itself? Does it spare those below 12?
It does not.
It does not.
It does not.
So where do we put them when the virus doesn't stop them?
We, again, you have to balance harms and benefits. So you have a vaccine here that should be efficacious, should be safe, and should do what it is supposed to do, and I, who is administering it, must have sufficient evidence that it will actually do what I want it to do. The moment I don't have that evidence, I will not deliver it because it may instead cause harm. All drugs, all vaccines, if given outside the prescribed conditions, they do the opposite. And that's not what we want.
How much time is recommended for me to take the second dose, between 1 and 2, or between the second and the booster, if I qualify for
Now,
the booster?
for first dose and second dose, it really depends on the manufacturer's recommendations. So if it is AstraZeneca or Moderna or Sinopharm or J&J, the durations are going to be different. You will recall that initially when we had started when we were using AstraZeneca from the Serum Institute of India, we started with the available evidence. Again, these things are guided by evidence. It was 8 weeks apart. But you will recall that at a certain point we increased it 12 weeks, if you remember very well. While for Pfizer, it came when it was 4 weeks. So it matters the duration between the first
we
dose.
actually thought you were increasing the duration to buy time.
No, it was evidence.
To get more vaccines.
It's
because
evidence.
you didn't have the
We
vaccines.
need to, no.
We thought you're buying time.
That was a misconception.
Yes, to
and
be
I
able
want
to procure some.
And I want to dispel that immediately, that for us in medical practice, we follow evidence. We follow guidance. So when a new vaccine or any new medicine is developed, it is studied in a clinical trial setting, and then later in a normal, in a normal healthy population. And so, based on the findings from that, then now you know that for this vaccine to have optimum functionality, the interval between the first dose and second dose must be this. As more evidence unfolds, that interval can change. That's why you've seen some drugs getting removed from the market, because they are no longer as effective as they thought they were. So that is what guided the intervals. It had nothing to do with whether the government of Uganda is buying time or not. So that interval between first dose and second dose still depends on the manufacturer's recommendations. And these are not static things. This is science. Science keeps winning, and it is science, keeps changing, and it is science that wins. So if the manufacturer now says from the available evidence, because these are new vaccines, we keep gathering evidence as we administer them. Those intervals can change. But you can trust that whenever there is a change, we all get trained, including our health workers. So the moment you come for vaccination, then you will be subjected to the protocols that are updated. Having said that, the booster at the moment, and this is the dose for those categories of people that need extra protection. These include the senior citizens, those who are above 50 years.
Above 50.
50 years and above. But also those who may not be 50 and above, but have comorbidities, where comorbidities are these underlying conditions, including HIV, including diabetes mellitus, including hypertension, including cancers. Those we prefer an interval of at least 6 months from the previous second dose before you can get your booster. So I don't expect someone to get a booster 2 months after the last dose. That booster will be wasted.
Okay.
It will not work.
But also, I want to know the right time between the first dose and the second dose for those who get Pfizer, AstraZeneca, Moderna, and the others, which is not J&J, because J&J is just one. And why I'm actually saying this is, there was agitation, there was that urge when we wanted the economy to open for us. The economy is open today. You only go to a few places where they tell you, don't come in without a mask. You only go to a few places where they'll tell you, please sanitize or wash your hands. But all the other places we go to, we now just go. And why do we do that? Is because we are sure we're vaccinated. Somebody says, because I vaccinated, whether with 1 dose, or you got the 2 doses,
I think that's not true. Maybe we need to first, we need to first talk about this.
That's why you came.
Yeah, because we are aware, and this is the message. It has never changed from the time vaccination started. We started by saying that the vaccines are to prevent you from getting severe disease, which means you are less likely to be hospitalized, but also you are less likely to die from COVID if you are vaccinated. But you will get infected.
Okay, so the Johnson & Johnson in me, or the AstraZeneca in me, or the Pfizer in me,
will not stop you from getting
stop
infected.
the virus.
No, but it
coming
will
in.
stop you from getting a severe virus. So what that means is that you will fall sick with mild
You will test
disease.
positive.
You will test positive. You may have some symptoms, mild symptoms. You can actually go about your business with your infection. You will most likely not be admitted because your disease will not get there. You will most likely not die from the disease. And because the vaccines are exactly doing that, the COVID vaccine, and that's what they are supposed to do. That's why you see less disease out there. And we are now claiming that the disease, we have defeated it. We have not. It is around. We have simple disease. We are moving around with it. That's why we are getting, simple disease that you can still work with your infection. As a result, you most likely won't even test because you're not feeling that bad. Now, that brings me to my second point, where regardless of your vaccination status, you must keep the SOPs on. The mask, a functional mask appropriate for that purpose, should be worn all the time. You must also social distance at all times. Whatever we are doing before must be done, must
Even
continuously be done, even when we are fully vaccinated. That's what I wanted to say. So it's not that now because the economy is open and so everybody should just walk without masks into the taxi, into the bus. No. The disease is still there. It still infects us. It's just that we won't get severe disease, so we will not end up overwhelming the health system and getting admitted, but we shall get infected and we shall actually fall sick.
Okay.
From COVID.
Do you realize that there are people, and I'm just very mindful about those ones, who got incomplete doses? They got the dose, like I said.
Yes.
They got the dose, and why they got the dose is because they wanted to get the numbers. Remember, we started, I think, with 4.8 million people.
Yeah.
We said we need 4.8 million people in those
Okay.
categories. When the president came back to speak to us, he said we have now risen, I think, to 5.1 million people because that included another category of persons in there who were supposed to get that. Then, of course, we started drumming. We had volunteers, NGOs, corporate organizations, all coming out to say, please, let's do this and get the target numbers. And that's what we're looking for, because the president told us, once we get these numbers, now you just gave us very good statistics here. We are talking about 16 million. 16 million. So somebody says we needed only 4 million. We have 16 million. We've surpassed 19 million. That's where we are. Now I am looking at a Habumdisha who got one dose, and midway they opened the economy, and nothing has happened to him. He's actually even saying, I got my dose in September. It is April, for heaven's sake. These are so many months later. Nothing has happened to me. I don't have COVID, I'm not sick, no symptom, no nothing. And I'm sure my friends here, the Ndiaba Hikas, Ndiaba Chiras have vaccinated, the Ratoros are vaccinated. Why do I even have to go there?
Yeah, I think I want to drive this point home by using a very weird example.
Please use the weird example.
So, when in most of African tradition society, there is what we call mweziche, tweziche, you know that the small village groups which contribute money when someone has died. They usually contribute about like 5,000 each household to be able to give a decent burial. Exactly. I have not seen anyone who complains that for the first 15 years I have been contributing when people in this village lose their people, and I have never lost someone to get my contribution.
I have contributed for 15 years.
For 15 years, people are dying in this village.
And
I have not lost my son or my wife.
I have not lost anybody.
So that I get my contribution.
To also get the contribution.
Yes.
Nobody can say that.
I am waiting to see if someone can say that. Now, I wouldn't expect that there is someone out there who is waiting to first be struck by COVID, so that they can say, COVID is here, let me go and vaccinate. I want to use that analogy to drive this point home. So, how do vaccines work? Maybe I need to go back to that. At the population level, vaccines help by breaking the chain of transmission. If Martin here is vaccinated, chances are that the disease will not need this Martin in order to access you. So if Martin is a block because he's vaccinated, the disease won't get you, even if you are not vaccinated. So as a result, it would mean that if I am also vaccinated, then we need the person next to me to get the disease to you. He will find it much, much harder to get the disease to you, because in between, everybody in between cannot be infected because they are vaccinated. So those who are not yet vaccinated are still benefiting from the few that are vaccinated. So what is our aim as health workers is to make sure we increase the mass of those who are vaccinated, so that we break these chains and the disease cannot move from one person to another.
What are our targets from M&E officer here? What are our targets, and what do we have to do to ensure that we get to those targets?
Initially, just like I said, we are looking at 18 years and above, who are close to 49% of the population. And just like I said, in Kampala, our targets were about 833,000, and which I clearly stated that at least each of these people have got one dose, and close to 75% are fully vaccinated, implying they've got their second dose, and some of them have had Johnson & Johnson. So we need a continuous effort towards this campaign for vaccination. We want that remaining population to come to get their vaccination. We are calling upon local leaders to gather their people and then call unto us to reach to them, because we have mobile teams that can reach every corner of the city. We want to have everyone in the city vaccinated, such that we can come back to normal. Thank you. Okay,
are you working with the politicians? Because Kampalans do think and believe in politicians more than they do believe in you, technical persons. Are you working with them? Are they helping you mobilize the numbers that you want?
Yes, politicians are on board because we believe people listen to them more than anyone else, because they are their people. So in this campaign, we have actually used the local councillors to mobilize the people to also actually get to us. In your electoral area, where do you want us to come and vaccinate people from? So we are using different stakeholders in order to achieve this together.
Dr. Alex, when we're receiving yellow fever vaccinations, or I don't know whether it's immunization or vaccination, but the yellow fever one, and majority of the people are, of course, coming to your hospital cases here, and we're telling them its validity in somebody's system is 10 years. So how long is it supposed to stay in my body? When does it get out of my body? And what effect does it have to my DNA?
The yellow fever?
Sir?
You mean the yellow fever?
No, this particular one. Because yellow fever, we're told 10 years.
Yeah, actually for yellow fever, the one we have now is lifelong. You get it once, you're sorted. Yes.
So how about this? When do I lose the J&J in me, and when will I need to put another J&J? And what does it happen? What does it do to my DNA?
So what I need to say is that coronaviruses, the family is as old as man. It's just that they were initially...
It's not a 2020 thing.
No. In 2020, it just crossed from animals to us and disturbed us. But before that, these coronaviruses have been they are as old as life. They are coronaviruses infect animals. So whatever happened and they crossed to infect us,